Thank you for watching today. My name is Michelle Clayton. I'm from the United Kingdom. I'm a member of the Nurse and Associate Concerted Action Group. I'm joined today by Professor Alejandro Forna from Barcelona, and he's a member of the governing board of ILC. Today we're going to cover a number of aspects. We're going to review the Nurse and Associate meeting that's taken place at ILC 2018. We're also going to talk about the role of the specialist nurse, and also we're going to look at how ILC can help you as a nurse.
I would like to ask you, Michelle, according to your view, which is the main role, or the potential roles of the nurses for the management of the liver diseases?
I think nurses are an integral part in relation to management of people with or at risk of liver disease. And I think actually we have a full continuum to consider. We should be looking at prevention in relation to liver disease and how we can actually help and assist with that right through the continuum of the disease process and right through to end-of-life care. And I think nurses have an opportunity to bring a different dynamic to the multidisciplinary team. Nurses are very good at supporting and educating patients, listening to their concerns, improving their experience when they're actually being treated. We have now a group of expert nurses who practice, and their advanced practice also helps to develop nurse-led services such as paracentesis, stable cirrhotic clinics. So again, we're developing that patient experience, that patient satisfaction, as well as the financial gains that a hospital might have, such as saving bed days and actually having a cost saving. So specialist nurses are actually very cost effective.
We have had a very active session today. I was sharing with you the session. And could you please summarize the main topics that have been discussed as you as a nurse, the things that you think that should be highlighted about the meeting that we have had this morning in the ILC in Paris?
Well, we've had two sessions today. We had one this morning and then we had a further session this afternoon, and actually we also had our poster categories today. So it's been a really busy day here. I think from this morning it was a case study presentation, and it was around an individual who suffered with NASH. What we gained from that was a very sort of multi-dimensional nursing care. So we had the initial case study. We then had a diabetes specialist nurse, and I think one of the things that I particularly took from her presentation was how important it is to get an early diabetes referral, because we need to work in conjunction and collaboration to ensure that the patient is getting optimum treatment, both for their NASH and also for their diabetes. It was then followed up by a really interesting session by a dietitian who talked about lifestyle coaching. And what she made us think about actually was how we have to work with our patients, that our goals must be smart, they must be achievable, they must be realistic for that individual, and that we work in synergy with the patient. And then the final part of it was thinking about the specialist nursing role and that development in terms of cirrhotic, stable cirrhotic clinics, nurse-led paracentesis, and how as a nurse we have many talents, and to be able to bring those together to ensure that our patient gets optimum care.
I told you in private, but I was really very surprised with the level of the presenters. They did an excellent work. I mean, they presented very smoothly the case. The discussion were really very nice, and I was very surprised, first of all, by the participation of the audience. A lot of people stand up and took the microphone.
They did.
And they asked really very good questions. The discussion was extremely active. And I remember that I told you probably that the best point is not only to demonstrate that the nurses may save money. This is good for convince the politics to put nurses in the hospitals, but I think that the key point is to demonstrate that with your task, not only are you able to save money, that is important, you are able to improve the outcome. This is the key point, and it was very nice to listen a colleague from Madrid that he explained that they were testing the quality of life and some outcomes when the nurse were involved in some aspects in the daily clinical practice, and I think that this is the way for working and to demonstrate that probably the nurse has an important role, not only for saving money, for improving the outcome, that this is the main aim for us.
I think as a nurse, what I would say is that I really do believe that nurses put the patient at the heart of everything they do, and it's really about patient experience, patient satisfaction and support of that individual person that's really, really important to nurses. It was lovely to hear the comments from the doctor from Madrid, and I think that shows the very collegiate working that some areas, some hospitals are utilising specialist nurses in a very integral way.
Just only explain that also in my hospital in Barcelona we have a very active collaboration with specialist nurses. We have a dedicated nurse for liver transplantation, a dedicated nurse for liver cancer, a dedicated nurse for hepatitis, a dedicated nurse for decompensated cirrhosis. And just only my experience as a doctor is obviously you need a big hospital, the doctors should be good also, but the quality of the management of the patients, the outcome, the quality of the life, and the degree of satisfaction is excellent and is significantly better when you have a dedicated nurse that can help you in all the clinical activities.
And I would agree with you with that. I think it's really important, and there are some really progressive hospitals, and yours is one of them, where you're actually embracing the role of the specialist nurse. And
also as an ISL GB member, obviously I would like to ask you directly, you as a nurse that you have been dedicated to the liver disease, what do you expect from ISL? How we can help the Nurses Association to improve the management of our patients and to make any collaboration? What's your ambition regarding the potential collaboration between ISL and the Nurses Associations?
I think it was really important that ISL recognised that nurses and associates were really important. And obviously ISL so far have made some opportunities. They've reduced the membership fee for nurses and associates, so that's been a very positive outcome. We've also had our abstract section this year, and the opportunity to have the abstracts has been great because that's produced 9 nurse-specific posters, and we hope that that will increase year on year. I think some of the other opportunities is that we can hopefully get both local and national liver nurse organisations to come together to work across the European liver nursing community. That is really important as well. I think one of the challenges that we might have is obviously funding. And it's difficult sometimes for nurses to come to ISL. They have not necessarily the same funding opportunities, and sometimes also they need to take annual leave rather than being afforded study leave. So I think that's something for the future that we need to look at. We also want to embrace such things as the having a school, an ISL school, a nursing school, and I think that will be really interesting to develop that concept and to look at the opportunity again to make that a networking opportunity across our liver nurse community. I think it's important that we have the ability for national, European and international sort of global liver nurse community to come together as well, and ESA will help to facilitate that because we haven't had that previously.
You have to keep in mind that the ESL was born because we want to fight against the liver disease. Obviously, the hepatologists, we have been a principal role in the fight against the liver disease, but we are completely aware that we are not alone. There are also other specialties like surgeons, radiologists, pathologists, etc. Also, we need to involve the basic research because it's important to have basic research for the improvement of the therapies and the knowledge of the liver disease. And obviously, we are aware that nurses, they have a pivotal role in the management of our patients with liver disease, and obviously ESL is the home of the people who is interested in liver disease, and for us it's really very important to involve all the people, all the actors that plays against liver cancer, and obviously nurses, you have a really very important role. We would like to join us, to help us, first of all, to be organized, also to open the ILC to the nurses. I'm more than happy to see in the room, it was full, obviously it was a small room, but probably near 100 nurses and non-nurses were inside the room. You have now a dedicated slot for abstract, and you may also take the opportunity to meet all the nurses that are interested in the liver disease, and I think that we need to follow this collaboration.
I expect that next year will be even better. I did a quick head count this morning. I counted nearly 120, which I think is brilliant, absolutely brilliant. And I agree, there were non-nurses in there as well, and that again is about our collaboration and collegiate working across the ILC community. I think it's really important that these opportunities, that we have these opportunities, and it will be interesting, I think, over the next couple of years to see how it grows and expands. So at the moment we're just on the beginning of our journey, but it will be interesting to see how our journey progresses.
Do you agree that we have to stimulate the participation of nurses in our community?
Yes, I do, and I feel very passionate about that, and this is why we are making opportunities for networking for those that can attend, and we're also now making links with national liver nurse organisations across European communities to make sure that we can disseminate and share information, good practice, guidelines, etc., because it's really important that we recognise that not everybody will be able to attend ILC, and that they have some avenue to be able to get that information.
And some platforms to share information.
Absolutely.
Michelle, thank you very much for being here in Paris. It has been a great honor to have you here in the Nurse Association meeting. It has been very productive. I hope to see you the next year in Vienna in the ILC 2019, and also I hope that in the next year we will need a larger room for allocating the Nurse Association meeting, and I think that this is the future, to collaborate with all the actors against the liver disease, and I can tell you that the nurses are one of the most important actors in our battle against liver disease. Thank you, Michelle.
Thank you very much. It's been a real pleasure to be here in Paris. Thank you very much for watching today.